Good afternoon, everyone. I'm Brittney Sala. I'm going to go ahead and get us started by pulling up the presentation, so just give me one moment.
Brittney, I think you're muted.
Okay, can everyone hear me okay now? Okay, I see
Yes.
head nods. Wonderful. Okay, one moment, please. My apologies. Okay, and if everyone can hear me, I will continue. So again, good afternoon, everyone. My name is Brittney Sala. I am the Wise Women Program Coordinator, and my wonderful colleagues and I are really elated to have the opportunity to present today about two of our programs focused on breast, cervical, and cardiovascular screenings, how individuals can access those screenings, and the necessary support services surrounding them. And we'll also talk about some of our partnerships on how we reach a much needed community to access these particular programs. And joining me today are my colleagues, Erin Brown. She is our breast and cervical cancer program coordinator. And we also have our lovely nurse consultants available today as well, Linda and Sherry. So we're very excited and happy to be here. So the Cancer Prevention and Control branch is located within the Division of Public Health, and we're under the North Carolina Department of Health and Human Services in Raleigh, North Carolina. So we're located within Wake County. And in total, our branch has 5 federally funded programs, all by the CDC. Plus, we oversee the legislative mandated North Carolina Advisory Committee on Cancer Coordination and Control. Today, we will be strictly focusing on the breast and cervical cancer control program, which is the pink and green logo that you see here, and our Wise Women program, which is located in purple and green logo. So within our Cancer Prevention and Control branch, we do have overarching goals that are reflected and embedded across all of our programs and projects. And those goals include preventing new cancers by increasing access to cancer screenings and early detection. We want to detect cancer at its earliest stages. We also want to treat cancer patients with the most appropriate and effective therapy. We also want to reduce cancer-related disparities across and in North Carolina, reduce the incidence and prevalence of cardiovascular disease, and we want to collect and publish North Carolina cancer and cardiovascular data. So whether we are working collaboratively across our programs that I mentioned or with a partner, we do that to achieve one of these goals. And this is what our branch supports and kind of how we measure our program's impact across our state. In addition, we also focus on certain populations, and that's based on the latest data trends and screening recommendations across our state or based on our state. So the breast and cervical cancer programs population of focus is the Latinx community, the African American Black community, Native Americans, Asians, the LGBTQ plus population, people with disability, and at the age of 21 plus for cervical cancer screenings and 40 plus for mammograms. In addition, for our Wise Women programs, we support the Latinx community, the African American and Black community, also Native Americans and Asians. In addition to that, we do support women at the age of 35 and up to 64 years of age who also have a low socioeconomic status. So you'll notice some variety here, or variety in regards to who we serve. That's mostly due to the fact that, particularly with our Wise Women program, it does highlight women specifically, which I'll cover. But as a branch, we are making sure to be very inclusive and mindful of who we serve. So we hope for the Wise Women program over time that we'll see a better reflection of our expansion of reaching those additional populations that we may not have in the past, which would include our LGBTQ plus population and people with disabilities and others. And next, Erin will speak regarding the breast and cervical cancer control program. So Erin, I pass it along to you.
All right, thank you, Brittney. So our breast and cervical cancer control program provides free or low-cost breast and cervical cancer screenings to eligible patients in North Carolina. What this does is our program kind of bridges the gap between Title X Family Planning, Medicaid, and Medicare by providing screening for early detection of breast and cervical cancers, the diagnostic workups, navigating patients into breast and cervical cancer Medicaid, and which can cover the cost associated with treatment. And we serve all 100 counties in North Carolina. We may not have a provider in your county, but you are eligible to get services. You may just have to travel to another county. We offer these services through local health departments that are funded, federally qualified health centers, as well as some private physicians' offices across the state. Next slide, Brittney. Thank you. So this is showing the 5-year average of breast cancer incidence and mortality in North Carolina by race and ethnicity. Our North Carolina incidence rate is 168 per 100,000 people. Nearly 56,000 women were diagnosed with breast cancer between 2017 and 2021, and nearly 7,028 women died as a result of breast cancer. African-American women do have the highest mortality rate. It's higher than the state's rate and higher than any other race groups. We know that routine screening can detect cancer at its earlier stages, which helps to prevent deaths, which is why our program is so important, and we're trying to do some outreach about it. Next slide, Brittney. Thanks. So to be eligible for North Carolina BSAP, you have to be uninsured or underinsured. So you either do not have health insurance or you have health insurance but cannot pay your co-pays. You have to be between the ages of 40 to 64 for our breast cancer screening services and ages 21 to 64 for our cervical cancer screening services. And you also have to have a household income below 250% of the federal poverty level. We see women and trans men, so people who have breast tissue and or a cervix, are eligible for our services. We serve patients regardless of citizenship. And there are other safety net organizations that we use that can assist if patients don't qualify for BSAP or BSAP Medicaid, such as charity care programs and other breast cancer foundations. Next slide, Brittney. I wanted to quickly highlight this partnership program that we have through the BSAP program at North Carolina. So what we're trying to do is increase our partnerships to help decrease disparities and provide further access to people who need those breast and cervical cancer screenings. So we have available, and this flyer is available on our website, and I will also drop my email in the chat box. If you are a 501c3 in good standing in the state of North Carolina, you can apply for partnership funding. Each event or service that you're providing has to have a breast or cervical cancer screening component. What we'll do is we'll connect you with a local BSAP provider that can then help navigate those patients seen during your event into the BSAP program for follow-up or additional diagnostics as needed. So I'm going to drop my email in the chat. It's also on this flyer. If you're interested, please apply. We would be happy to partner with you to provide services to more people. And I'm going to pass it back to Brittney to talk about BSEP.
All right, thanks, Erin. So next I'll go into the North Carolina Wise Women program. So Wise Women stands for Well Integrated Screening and Evaluation for Women Across the Nation. It's a sister program to the National Breast and Cervical Cancer Early Detection Program and a sister program to BSEP here in North Carolina. Congress appropriated funds from the breast and cervical cancer program to address the whole health of a woman, and that is how Wise Women was funded. Our program specifically is one of the oldest funded programs. It started in 1995 when Wise Women was considered a demonstration project. And the mission of Wise Women overall is to reduce the incidence and prevalence of cardiovascular disease among women across North Carolina through the provision of knowledge, skills, and opportunities for lifestyle behavior change. And the way we do this is through the provision of services for our eligible population that I mentioned earlier. So that's women who are between the ages of 35 to 64 years of age and who are below 250 of the federal poverty level and are either found to be uninsured or underinsured. Women who come through our program are offered our cardiovascular risk reduction screening, which includes measurements of lipids and blood glucose, height and weight, and also an additional health risk assessment. And from there, those who qualify and participate in our program are then provided risk reduction counseling that's supported by motivational interviewing strategies. And they're also referred to a healthy behavioral support service. I'll go over a few of those in a moment. And that really aids them in reducing their risk and adopting lifestyle behavior changes such as healthy eating, or increasing their walking activity, yoga. It's up to the individual woman of what she decides to support and do. And our program has blossomed since 1995 through our population and outreach strategies. And these strategies aid to, again, reduce that incidence and prevalence of cardiovascular disease across our state. So ways that we do that through our partnerships is that we promote the screening of women between that 35 to 64 years of age to really talk about identifying cardiovascular risk factors and ways they can improve upon it. Again, our partners definitely focus and target on the low income and minority populations. Just due to the latest data, we recognize that minority populations are at a higher risk. We also support our local service providers in the adoption of strategies and recognition of undiagnosed or uncontrolled hypertension among their patient population through our HeartWise project or program within Wise Women. And then lastly, we leverage our strategic partnerships. So we refer a lot of the women enrolled to our programs to those healthy behavior support services that I mentioned. And this could range from diabetes prevention, a walking program, a healthy eating program. It's just a matter of supporting the patient. And in addition, they receive, if they participate in our self-monitored blood pressure program, they would receive a blood pressure cuff, they would receive a packet of resources, referral to a supportive service, along with health coaching as well. So a few of those healthy support services that I mentioned included health coaching, our North Carolina HeartWise program, which focused specifically on self-monitored blood pressure regulation and support. We also partner with Eat Smart, Move More for their diabetes prevention program and Walk with Ease. And there's additional community-based resources such as partnering with our local YMCA or YWCAs to support any particular yoga or walking or physical activity or diet nutrition programs and projects that are available to the women in our catchment area, so to speak. And not only has heart disease surpassed cancer as a leading cause of death in the United States, but there is evidence and a link between cancer and cardiovascular disease here in North Carolina specifically. An analysis from and discharge data from our partners at the North Carolina Cancer Registry found that in a 2-year span, so this was from 2014 to 2016, that over 7,720 individuals with cancer were hospitalized with a cardiovascular related admission. And those top cardiovascular related admissions varied in type, but they included congestive heart failure, stroke, and atrial fibrillation. What's not shown here is that in addition to that, what was also shown in the analysis that was associated with cardiovascular related admissions was lung cancer specifically, and breast cancers that have the highest incidence adjusted rates when it comes to those admissions in North Carolina. And our partners at the Cancer Registry did conclude that more studies are needed to decipher ways to prevent cardiovascular admissions in this particular high-risk population, but we do work collaboratively through our partners to make sure we're addressing these particular cardiovascular risks and concerns with our patients who participate in our program. And looking at the map here of the heart disease death rates by county of residents here in North Carolina, it's definitely prevalent and obviously something very important that we acknowledge and recognize, that heart disease is a significant contributor and factor across our state. So the Wise Women program really tries to identify, seek, and find partners that are open to working with the women that serve our program or participate in our program and getting them the necessary resources so that they can reduce their risk for cardiovascular disease. And this was presented earlier, but we did want to show you a bigger example of our map that shows our breast and cervical cancer and Wise Women provider locations. At this current time, as Erin mentioned, BSEP can serve 100 counties, but we recognize and acknowledge that travel is definitely something that would have to happen in order to get to a particular provider, but we do try our best to make sure that there is a service available when necessary to meet the needs of women, men, and all individuals across our counties. In addition to the Wise Women program, we're currently located in 28 counties across the state. So that's where you see the hearts. This will shift in our next program fiscal year, which will take place in September. We'll be adding and adjusting some counties that have decided to join our program. So we're very elated about that. But we just wanted to provide a resource so that you see that we do work diligently across the state, across both programs, to make sure that anyone that's in need of our services that meets the criteria are able to get the necessary resource. You can also find this on our website, and we'll make sure to drop that in the chat as well. And next, I'll pass it back to Erin to speak about our barriers and solutions regarding our breast and cervical cancer and Wise Women programs.
Thank you, Brittney. So as you can imagine, implementing this amount of work comes with challenges and barriers, and both internal within our programs and on the community and provider level. So to ensure that we are providing equitable services and with our focus on health equity, we're constantly pivoting and coming up with solutions to alleviate some of these challenges. Again, the majority of those that we'll need is through partnerships. So that can help us alleviate some of the barriers that we ourselves are not able to assist with. But just a few examples of some barriers and some solutions on this slide. So participants who don't have transportation, we developed a guide to utilizing mobile mammography units that our clinic providers who are doing BSEP can rent a mobile There's a list of all the mobile mammography buses throughout the state, and they can take them into the local communities to kind of help alleviate that transportation barrier. Some clinics are also working on gas cards, providing options to mail stool tests back for colorectal screenings. That's with our NCPICS program. We may see a decrease in patient enrollment in BSEP and Wise Women due to the Medicaid expansion. So we're trying to combat that by utilizing community clinical linkages, partnerships, and then patient navigation to help get patients into these programs. Even with the expansion, not everyone is going to be eligible still. Cost of cancer treatment is a barrier to many people. So we have breast and cervical cancer Medicaid, as well as charity care and several other breast and cervical cancer organizations to help with the cost. Patient knowledge on cancer and cardiovascular risk factors. So we have actually done motivational interview training to clinic staff members to help provide patient education, help them understand the importance of coming in for their screenings. Staff turnover at a local clinical level. This is not just BSEP and Wise Women. This has been across all fields since COVID happened. So we've created process maps and workflows to help with short staffing and training of new hires, workflow automation within the electronic health record systems to help with patient reminders. We also provide technical assistance and trainings on our program implementation to all funded providers. Then we also have the barrier of a lack of primary care services at the local level. And so we've placed an emphasis on team-based care and those community partnerships again to access other primary care and support services. But of course, I want to just reiterate, one of our biggest barriers is transportation. So we're still currently working on that one, and I just wanted to highlight it. Next slide, Brittney. Thank you. So as far as our Cancer Branch health equity recommendations, we want to build community empowerment to address health disparities at a local level. As we work through our cancer plan to prevent new cancers by increasing access to cancer screenings and early detection and reduce cancer-related disparities in North Carolina, we want to build that community empowerment and identify partners in the local community that can help us address some of the social determinants of health. We want to identify, build these strategic partnerships with community organizations in a variety of settings to do that. We want to use community outreach and engagement, navigation, and then make good use of our community clinical linkages to help reduce those cancer disparities and increase screening. So the gaps that we can't fill, we're actively striving to work with partners and community organizations to help fill those gaps. And we also want to encourage active participation in cardiovascular, breast and cervical cancer screenings. We want to promote our programs, the services that we provide, and the benefits of our program. We want to increase referral and retention rates. So people coming into our program and people coming into Wise Women, and strengthen the partnerships between these organizations and engage our communities, because you don't know what you don't know. So if you don't know about our programs, then you don't know how to access them and to get those cancer screenings. Next slide, Brittney. So this is just an image that our Cancer Branch had created to show the importance of connecting with community partners in order to bridge the gap to care. So this is just showing the gap between the person who needs treatment and the provider. And in this river down here, the ones highlighted in red are the barriers in particular that our program is working with different organizations and brainstorming to help fight. So language barriers, transportation, clinic access, and uninsured persons. There's many upstream factors that are outside of our control, such as, your work environment, your employment, environmental facts. But We are working to bridge the gap between clinical providers and community-based organizations to provide education and decrease these barriers as best we can as we address social determinants of health and improve patient and population health overall. Next slide, Brittney. Oh, thanks. So this is a list of some of the partners we work with. This is by no means conclusive. There are too many to list on a slide. I just wanted to highlight some of them. But we work with these partners to make this happen. We connect and engage with other state programs, universities, national organizations, and most importantly, various community organizations so that we can reach individuals that we know need these services. They have methods and ways that they can help that we can't. So by partnering together, we can get all these patients into breast and cervical cancer screenings and the Wise Woman program. And I believe I'm going to pass it back to Brittney now, right?
Yes, thank you, Erin. So you've heard us speak about both of our respective programs, our need for these wonderful partnerships so that we're addressing health equity, we're helping individuals get into these wonderful services that we have access to. And I think what we also want to share is just how to put that all into action. So while all of our programs that we shared, including the breast and cervical cancer and Wise Women programs, we also have those 3 other programs within our branch. We make sure to prioritize all of our work and deliver our services to North Carolinians, by aligning our work with the Comprehensive Cancer Control Action Plan, as you see here. Our actions are very intentional, and our work is done through a health equity lens when we leverage and utilize this particular document. This was created by our Comprehensive Cancer Control Program. And what it highlights is that if you, for example, want to work with us, if you're engaged and you're interested in discovering that you want to help us reach more individuals to get access to screening, and you're interested in maybe in applying for that sponsorship that Erin mentioned, the great thing about the action plan is that it actually takes you step by step based on the type of cancer and program or type of entity that you are, and creates an action plan of how exactly to do that, how to collaborate and work with us. So we'd be happy to share that resource with you. It is available on our website. We can also connect you to our other lovely program coordinator to get additional information, but we wanted to make sure to highlight this particular resource as it's a great way to really think about how to be strategic and supportive of those that we serve, and ways to collaborate as well. And continuing the visual that Erin mentioned, I think something else that we just wanted to make sure to highlight is that while we recognize we cannot address any and all concerns of individuals, we try so hard to really bridge those gaps and address the barriers that we can control through our community clinical linkages and making sure they have preventative care through our breast and cervical cancer program. So again, just highlighting that through our community engagement partners, all the way to helping to bridge that gap for them to get to our clinical providers, what we can support and do at this time are what is highlighted in red. So we offer language interpreters if necessary, particularly like for Wise Women, when we do health coaching, that is an option that we have a language interpreter available. Transportation, as Erin mentioned, we're working really diligently to try to be really mindful of the fact that North Carolina, we were fortunate enough to have these programs and entities, but we really got to be mindful of how individuals get there. We think it's great that we're able to share the resource, we're able to share that you may be eligible, but now let's make sure you can actually get to where you need to be, which is to these particular resources. So alongside of the gas cards and making sure that we place mobile mammography units in communities that may be rural or may not have them, we're also looking into actual Department of Transportation to see what we can do about buses, vouchers, just being really mindful and really clear about what we can and cannot do to support individuals to get through to get to our doors. Other vouchers we're looking into could be maybe potentially childcare. We know that's again, that's very preliminary, but we do recognize and acknowledge that that is a concern. People have families, so how can we support vouchers or resources that if someone needs to get screened, they're able to have a voucher to get necessary support. And of course, screenings we're able to support through our breast and cervical and cardiovascular screenings, along with colorectal, and a few other of our priority cancers that were not mentioned, which were lung and skin cancer, and prostate as well for screenings, and also breast and cervical cancer Medicaid. So just making sure that you all are aware that while we recognize we have wonderful individuals in and navigators in our provider community, we're also making sure to strive and build relationships with entities and individuals that can serve a multitude of purposes to get individuals to these necessary screenings. And that will conclude our presentation for today. We really appreciate the opportunity to be here.